today, I think some of the common challenges we all face is, being an allopathic practitioner. People ask me, why do you believe in herbs? And I think that's a myopic approach because today we are in the era of integrated complementary medicine and holistic care. So 50% of the cancer drugs that we use today, including drugs like paclitaxel, are all of plant origin. Please remember this, that the pharmacology industry and have put a process to developing a drug. And this is how even the regulatory authorities have put a system in place. So whenever somebody says you are practicing only this, you should not support that. I think time has come for that approach globally for us to look at integrative approaches, one. Second, I think I've faced a major challenge in looking at harnessing collaborations. Today, if you look at our team of 3 inventors, Ganesh is an organic chemist with a PhD who himself is from the drug discovery background. From the topmost US FDA labs running it, he understands the most important shortcomings of active ingredients to the potential of a complete herb. To Mr. Srinivas, who's a pharmacology expert and who encouraged us to understanding the pharmacodynamics, the pharmacokinetics, the dosaging, the toxicology. So you need a proper effective team, which took me a long time to gather. And that's what brought about the efficacious and the quick rollout of the science of this particular product. And I think what needs more is, I think the Indian knowledge system has the potential of answering some of the most difficult conundrums in the history of mankind if we were able to fund research and development. And I think this is where I would reiterate that many times we kind of hesitate to fund science and we get busy trying to fund technology. Science at this juncture needs funding, research needs funding so that more inventors like this are going to come forward and give greater solutions to the world.